मैम 2 से 4 मिनट लगेंगे, अभी वो वापस से रिजॉइन करेंगे
क्योंकि
आपको।
क्योंकि वो ही नहीं आ रहा था।
हाँ।
स्टॉप कर दूं? क्योंकि वो ही नहीं हो रहा था ना। उसने जो बोला कि मैं थम्स अप दूंगी वो भी नहीं ले जाओ, चेक करो सारा। LFT फ्रेश करा लेना अभी, आज। ठीक है सिस्टर?
Yes, ma'am. Yes.
Okay. Namaskar. I'm Dr. Malti. I'm working for Apollo Fertilities, Noida Center. I'm looking after Noida Center. I'm the senior IVF and infertility specialist over there. Today I'm going to talk about IUI. IUI is intrauterine insemination. There is one another name for IUI, that is artificial insemination. IUI is one of the most widely used treatment option for infertile couples. Uh, in IUI, the washed semen sample or the sperms are directly put inside the uterus. So it is also called as artificial insemination. As we all know that during natural intercourse, the sperm is deposited in the upper part of vagina. In IUI, the vagina and the cervix is bypassed and the sperms are directly placed inside the uterus just to increase the probability of fertilization. So there are various conditions where IUI is used as treatment option. IUI can be used in natural cycle of a woman. Natural cycle means that if she is ovulating on her own, then IUI can be used to increase the chances of conception. And also in stimulated cycle. Stimulated cycle means that when some drugs are given just to increase the probability of fertilization. IUI can be used in variety of conditions, in many conditions, and yes, it is one of the most widely used treatment option by the infertile couple. One by one, we will discuss all the conditions where IUI can be used. The most common indication, one of the most common indication for IUI is male factor infertility. Whenever the male partner is having some sexual problem like erectile dysfunction or problems of ejaculation, the couple not able to have natural intercourse, then in all those cases IUI can be used to help them to get pregnant. Also, if there are mild male factor infertility, like there are mildly deranged semen parameters, like there is mild decrease in the number of sperms, then their motility and morphology. In that case, also IUI can be used. I would like to clear my point that in all the cases of severe male factor infertility, like grossly decreased or deranged semen parameters, IUI may not be the correct option for them. They should go for IVF directly, IVF or ICSI. Then all the donor sperm cycles, like whenever the women needs donor sperms to get pregnant, then IUI can be used as a treatment option. The uh, donor semen can be taken from the semen banks, the sample can be thawed, and then it can be used for insemination. Then mild to minimal endometriosis. In cases of mild to minimal endometriosis, especially if the age of women is less than 35 years and there are no other factors causing infertility, then often IUI is the first treatment option that is offered to the couple. Certain drugs are used to induce ovulation and then IUI is used. Then unexplained infertility. In unexplained infertility, especially if the female partner's age is less than 35 years, then again IUI is the first modality of treatment. Uh, Also, in cervical factor infertility, cervix is the opening of uterus into the vagina, and cervix contains thick cervical mucus that gives ideal environment for the sperm to travel from the vagina to the uterus and then to the fallopian tube. But sometimes the cervical mucus is too much sticky, and in these cases IUI can help to bypass the cervical factor infertility. Then also ovulatory factor infertility. In some cases of anovulation, IUI can be combined with the drugs that are used to induce ovulation just to increase the chances of conception. Then, what are the prerequisites of IUI? There are certain conditions that needs to be fulfilled before before the couple opts for IUI treatment. Like the women must be ovulating either simultaneously or with the help of drugs. Then she must have at least one of the fallopian tube that is patent and working, and then the male partner must have sperms in his semen samples. uh, there should not be any gross abnormality in the semen parameters. So the tests that are done before IUI are the HSG test for the female partner, in addition to the normal blood test, basic blood tests like CBC, and then test for sugar, thyroid status, etc. And in male partners, there must be a semen analysis before the couple opt for IUI. And then, how is the preparation for IUI is done? Uh, For an IUI cycle to result in pregnancy, the IUI must be done around the time of ovulation. So, if the couple are going for natural cycle IUI, then the ovulation can be tracked with the help of LH kits or ovulation kits that are widely available. And whenever some drugs are used for ovulation induction, then it's always better to do ovulation tracking with the help of serial ultrasound examination that is called follicular scan. Follicular scan is performed starting from the baseline scan on second day, and then from ninth or 10th day onwards the follicular tracking can be done with the help of ultrasound examination, and the timing of ovulation can be predicted in that way. Sometimes the drugs like chorionic gonadotropin injection, human chorionic gonadotropin injections, or injection HCG is also used to induce ovulation. And now, the determination of the timing of ovulation. Whenever the HCG injection is used for ovulation, then it's better if we do, or if we do IUI within 34 to 36 hours of the injection HCG. And preparation of semen sample. What is semen sample preparation? At the time of IUI, the male partner is asked to give the semen sample, and then semen wash is performed. The semen contains its healthy sperms and the seminal fluid. Seminal fluid has certain hormones and other chemicals like prostaglandins. And if this semen sample is directly introduced into the uterine cavity, then they may cause sort of allergic reaction. Like the women can have severe abdominal cramping, pain, and nausea, and fever sometimes. So the semen sample is washed. In the process of washing, the healthy sperms are separated from the seminal fluid, and then the sperm is introduced inside the cavity of uterus. So, what do you expect during an IUI? I would like to clear that IUI is not painful at all. It's like a general gynecological examination. You must have undergone pap smear test or gynecological examination in which a, vaginal speculum is inserted. So, likewise, a vaginal speculum is inserted, and then A very fine catheter is introduced through the cervix into the uterus, and then the washed semen sample is gently pushed inside the uterine cavity. So the process hardly takes 10 to 15 minutes. Once the process is over, the woman is generally instructed to lie on her back for another 10-15 minutes to increase the chances of success. And after that, she can go home, she can drive, she can resume her office work or general household work, that whatever is in her routine. Regarding sexual intercourse, she can have intercourse whenever she feels like. Uh, it has been shown in several studies that the women who had sexual intercourse after the process of IUI have better chances to conceive with IUI than the women who stopped. So, what about the results? Generally, 2 weeks after the process of IUI, we can know the results with the help of either blood test for serum beta HCG or the urine pregnancy test. We can know whether the IUI process was successful or not. If it is successful, like if the urine pregnancy test is positive, then the women meets a gynecologist, and generally the support medicines are continued further till the first scan or after that. And if it is not successful, then she will have her period soon, and then planning for second cycle is done, like another cycle of IUI or higher treatment, whatever she needs. Why IUI fails? People often ask that why IUI fails. Let me tell you that IUI results are not that great. It's about 5 to 8% if the IUI is performed in a natural cycle. The success of IUI increases whenever fertility drugs are used in addition to IUI, and it's around 8 to 15%, maximum 15% per cycle. So, the failure can be due to the poor quality of eggs or poor quality of sperm or inability of sperm to fertilize the eggs. Then poor endometrial lining can be the another reason for failed IUI. So, is there any risk of IUI? Patients are often concerned that what are the risk of IUI? Like sometimes, very rarely, if the semen sample is not washed properly, then the prostaglandins may be introduced inside the uterine cavity, and some of them may have cramping. But in a proper center where IUI is properly performed under full aseptic precaution, that's not the case. Another thing is that some of the women may have spotting for 1 to 2 days after the IUI. That is normal. There's nothing to worry about that. Then multiple pregnancy. The process of IUI doesn't increase the rate of multiple pregnancy, but whenever ovulation induction drugs are used, especially in the case of polycystic ovary, and it results in ovulation of more than one follicle, then there may be chances of multiple pregnancy. So, not in all cases. So, on which factors the success of IUI depends. It has been seen in studies that if the female's age is less than 35 years, if the fallopian tubes are working, and if uh, there has been the ovulation of more than one follicle, the chances of IUI is more. And up to certain extent, it also depends upon the timing. IUI should be shortly performed as the semen sample is ready. So I think, in a nutshell, it was all about the process of IUI, and I hope the session was informative. You can let me know if you want to ask some something more. I mean, some more details about the IUI. Thank you. So there has been some questions, and I think I can answer them one by one. The first question is that what kind of food should we have during IUI cycle? After IUI, there is no restriction of the food. Sometimes it is asked that um, plenty of pineapple slices they have to avoid. Otherwise, they can take balanced diet. There is no such instruction, specific instruction about the food. Then another question is what is the success rate of IUI? As I already discussed, that the success rate of IUI varies between 8 to 15%. And depending upon the female's age, it is decided, and other factors that are responsible for infertility, it is decided that how many IUI cycles are recommended. See, in all the patients with severe male factor infertility, it's not going to work. So if the semen sample is like less than 1 million motile sperm counts are there, and we are going to repeat many cycles of IUI, it is not going to help us. In all those cases, we should go for higher treatment, that is IVF or ICSI. But in young females, in unexplained infertility, or in cases of ovulatory dysfunction, we can go for 3 cycles of IUI. Another question is bed rest recommended after IUI cycle? Just after the process of IUI is complete, I also instruct my patients to lie on their back for 15-20 minutes, and then they can resume their normal activities, whatever is there in their routine, like office work or normal household work. There is no restriction about that. I think that's all. There are no further questions. Thank you.